Welcome! Let's look at how you can utilize a learning experience platform to meet the needs of the medical field. Our goal is to paint the picture of potential use cases, but get your juices flowing, as this tool has endless possibilities. Let's start by getting registered. This registration link was sent to me by my employer, by the place that I'm going to volunteer, and it's unique so that it cannot be accessed without that information. As I create my login, a username and password, I also have the ability to choose a group. So I'm going to be a volunteer, and therefore I select that group and go ahead and get registered. As I enter, I am brought to my dashboard. Here I can see the lay of the land of all my learning or things I need to utilize for my job. Especially in these times, process is very important. So I see that I've got 2 things that I need to continuously work on and check on a regular basis. For example, symptom triage or clean a patient room. These can be any type of checklist or resource that a clinic is using to ensure quality or that the process is being followed correctly. Obviously, right now, that is a top priority, and that's why you see it here, first thing that you need to do. Additionally, I can see assigned learning. So we've got coronavirus, general information. So if I click into this course, I am brought to an area where I can get information, up-to-date information on the coronavirus. As an employee or a future employee or a volunteer, I am being sent numerous items around coronavirus on a regular basis. We all are. But this gives an opportunity for an organization, a doctor, a medical clinic, the ability to curate the most up-to-date, slimmed down information that they want their particular team to know. So it could be a potential e-learning. It could be PDFs, videos, potentially information on how to make sure you stop the spread of germs, washing hands, things that are of utmost importance all the time, but really right now. And as you can see, Jane here has interacted with her team and her potential employer and noted that this is great information and she really enjoyed it. So as we return back to the homepage, I can then also access volunteer resources. So in our most recent experience, there's a heavy need for volunteers or new employees that maybe came out of retirement. And there's some things that they need to fill out or agree to as they get started. So what we've done here is we've provided volunteer forms, volunteer resources. You could do employee forms, employee resources, staff forms, staff resources, all of those things. And as I click into volunteer forms, one of the neat things that you can do with this tool is to provide, for example, HIPAA information, a policy for that particular practice that a volunteer or a team member or employee needs to know. They can accept that they've read and understand the following guidelines. They sign their name, provide an email address, and date it so that you have record, but you don't necessarily have to have them sign every single piece of paper. So as I return, I can also see some resources for my volunteers. Similar to what we mentioned in the coronavirus course, this can be a place where you provide resources, whether it's coronavirus specific or it's just specific to good care and providing the right experience for your patient. All of those things can be curated here. So, for example, the CDC has a recommendation for infection control. That can be placed here. You can also link directly to a specific spot on the CDC website so that, again, they're not overwhelmed with information and I'm able to see exactly what my provider wants me to see. And as we know, healthcare professionals are always continuing to learn. They're always needing continuing education. And so what we have the ability to do is to provide a way for these users to receive their continuing education through this platform. So this can be, the tool comes with a bunch of curated content, but in this instance, it probably would be more specific and curated content that can be put into this tool and provide a single place for people to go and to access that education. So it's pretty simple to add. So I see I've got communication, continuing education, people management for those leaders in healthcare, but then let's say mindfulness and well-being. And we'll submit that. And then I am given a resource library all around mindfulness and well-being. These can be, again, they can come from the tool, or you can put more different items from maybe a university or a continuing education department at a university. And all of that can be curated here for the user to access. As you can see, the tool is very flexible. There are lots of possibilities of how it can be utilized in the healthcare industry. We've seen most recently this being used with a medical clinic that is having a high demand need for volunteers. And so they are utilizing people who may be in medical school or have been retired from the medical field or have moved on from the medical field. And they are volunteering to screen patients before coming into a clinic. So taking temperatures, things like that before they enter the clinic to keep everyone safe. And so this provides a quick and easy way for them to give the information to the volunteer, them to go through it, track it, and make sure that they are using this in the most efficient way and getting those volunteers up to speed in the most efficient way so that they can continue to serve as many patients as possible. So I look forward to hearing your feedback, ideas around potential process items that medical fields may need, and we look forward to discussing more.